Come in.
Hi, Phyllis. My name's Diana. I'm going to be your nurse today. How are you doing?
I'm okay, but my stomach feels a little full and I'm unable to urinate.
Okay, that is exactly what I heard in the report. I was hoping to speak to you about that. The doctor does have an order for a Foley catheter, which I can insert. Are you familiar with the Foley catheter?
Yes, I am. I had one with my last surgery.
Okay, and just to confirm, no allergies to iodine or latex?
No.
Okay, good. All right, well, first I would like to just take a look at everything. So let me close this for privacy. And I'm gonna get some gloves on. And then I was told that just a few moments ago, the PCT came in and performed some peri-care and got you all cleaned up. Is that correct?
Correct.
Okay, wonderful. First, I'm gonna just assess your abdomen, take a look at everything. Take this down. Okay, yeah, you do look a bit distended, but no pain?
No.
Okay, just that feeling of pressure and fullness, like you have to pee, but you can't?
Yes.
Okay. Well, the Foley will certainly help with that. Let me get all my equipment set up here. Okay. So, what I have here is the Foley catheter kit. I have a Foley stat lock, which is kind of like a sticker for your thigh to attach the tubing when we're done. And then I do have a garbage bag here just to get all the waste from the packaging. All right, first, bring this down. And since the blanket is gonna be pulled down, I did bring an extra blanket in here, keep you covered up and a little bit more cozy and comfortable. Before we start with anything, can you go ahead and just confirm your first and last name for me and your date of birth?
Phyllis McCracken, 317XX.
Perfect. All right, thank you so much. Let me repeat my hand hygiene. Would you be okay if I put the garbage bag over here on the side of your bed?
Yes.
Okay. It's helpful if it's within reach. All right, I'm gonna bring this up a little bit. Bend your knees. Okay, so the peri area is all cleaned up. I'm gonna open up my kit here. Set that there. Okay. I'm going to very carefully open this up. Okay. I'm going to put on my sterile gloves. Grabbing the other one. There we go. All right. Okay, we are good to go. This is a drape that I'm going to place underneath you. There is a shiny side and a dull side. You tuck that as close to the peri area as possible while being careful not to touch your legs. This is an extra drape that I don't need for this insertion, so I'm just going to put that off to the side. I've got the 3 cleansing swab sticks that I'll just get opened and ready. All right. Bring this out. I'm going to attach my syringe here, my flush. This will inflate the balloon. And then this is also where I would open up to this lubricant and put it in this dish. But for the purposes of this video, I will not be using this. I will be using mannequin safe lubricant, and the instructor will pour that into that area at this time. Perfect. Thank you. Okay, so this will go away just for now. Now I'm going to apply a little bit of pressure to your labia and kind of just open up the area here. It's time for cleansing. And one more. Good job. Okay. Now with the tip of this, I'm going to put it into the lubricant, about 1 or 2 inches worth of coating on the lubricant. And on the count of 3, I'm going to insert the catheter. You might feel a little bit of pressure, but go ahead and bear down like you're having a bowel movement, okay? 1, 2, 3. Good. You advance until you see urine, and I do see urine. At this point, I'm going to advance it about another inch or 2 more to make sure that it is fully into the bladder. And at this point, I will go ahead and pinch that area to keep the catheter stable. Okay, go ahead and fill up the balloon here. Good. Now you can disconnect this and give the catheter just a little tug. Good. So you can tell that everything is intact and properly inserted. From here, I'm going to get rid of my garbage and just get it out of the way. Okay, the doctor does want a urine specimen, so I am going to obtain a urine sample right now. And because this is a brand new Foley and a brand new Foley bag, I can obtain the specimen through here. If it was not a brand new bag, I would need to get it through the port. So I disconnect that here. Fill that up. Careful not to touch the inside of anything here. Place that back in there. Okay. And here, can you please repeat your first and last name and date of birth for me so I can make sure it matches the label?
Phyllis McCracken, 317XX.
Perfect. Okay. So I will get that into the biohazard bag and off to the lab momentarily. I am going to place a stat lock real quick here. This is to make sure that everything stays nice and secure. So this is a skin protectant pad. I'm just going to go ahead and place on your thigh here. And then I do like to go ahead and click this in prior to it being attached to you. That way I don't have to push so hard. You want to connect it to the thigh and make sure that you've got a little bit of slack. So it won't be too tight. Oh, came out. There we go. Let's connect it again. Okay. Good. Let me just get that placed over here. Get rid of my garbage. You did fantastic. How do you feel?
I feel much better.
Good, good, good. Okay. Let me bring down your legs here. I would like to just pull this up and reassess your stomach. Okay. Yeah, the distension does look much improved. You've got a good amount of urine output. Okay. Good. Still no pain?
No pain.
Excellent. Okay. Looking much better. I will be checking on you shortly. Aside from that, is there anything else that I can do for you right now?
Nope.
Okay. You put your bed down, and I will be seeing you in just a bit.
Thank you.
You're very welcome.
Come in.
Hi, Phyllis. Your call light's on. What can I do for you?
So I feel like something's going on where my stomach's full again.
Oh, okay. Well, let's go ahead and check it out. All right. Is it okay if I expose your stomach real quick?
Yes.
Good. Yeah, you do look distended again. Well, there's no kinks in the tubing. There is urine in the bag, but it's not tons of urine. I do have an order to irrigate the Foley tubing. Let me go ahead and get all my supplies ready and we'll take care of that for you, okay?
Okay.
Get my gloves ready as well. And then before we tackle that, can you go ahead and confirm your first and last name and date of birth?
Phyllis McCracken, 317XX.
All right, perfect. My irrigation supplies. So for this, the doctor has ordered that I can do 30 ml flushes of 0.9 normal saline. So that's what I've grabbed here. You know what? I did forget to grab alcohol preps. Let me grab that. I'll be right back. Perfect. Alrighty. What I like to do is just take it out of the stat lock here to make sure that I have a little bit more mobility with the tubing. I will be cleaning this port momentarily, but first let me draw this up. Draw up 30 mLs, 30 cc's. Okay. Looking good. I do need to set this down momentarily, so I'm going to set this back inside the sterile packaging until I need it. So for this, I'm going to grab this port here and scrub the hub, clean it off. Okay. Now, connect this, click it in, and for injection, what you do is you clamp the clear portion and you're going to be pushing the normal saline into the bladder of the patient. For the purposes of this video, I will not actually be putting in the normal saline, but that is what would be done at this time. So push, 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 push. And oh my goodness, look at all of that urine flow. Excellent job. Okay, it's free flowing. That knocked away any debris or sediment that may have been blocking your Foley catheter. So how do you feel now?
Much better.
Good, good, good. Okay. Oh, that's not in all the way here. Got twisted. Okay. Well, good. Before I go, yep, that Foley bag is filling up nicely. That looks really, really good. Okay. I would like to just reassess that stomach one more time, and the distension has gone away. Good. If you experience those symptoms again at any point, please let me know right away and we can repeat this as needed. Is there anything else that I can do for you right now?
Nope, that was all. Thank you.
No problem. Get your bed lowered down. You got your calm light. And you are set. All right. Have a wonderful day. I will see you in a little bit.
Thank you.
Mm-hmm.